When you go to the doctor, you're looking for one thing: an answer, a diagnosis. It's supposed to be the bedrock of all medicine. But what if that very foundation is cracking? What if the system we all rely on is facing a massive hidden crisis? That's what we're going to dig into today: why it's happening and what we can actually do about it.
So here's our roadmap. First, we'll shine a light on medicine's big blind spot. Then we'll get into the real-world cost of just guessing. From there, we'll check out a new framework for excellence, explore the tech that's making it possible, and finally, look at the global fight to close this gap for good.
All right, let's jump right in with the sheer scale of this thing, because we're not talking about a tiny problem in a few faraway places. No, this is a huge, often completely invisible vulnerability in our entire global healthcare system. Check out this number: 47%. According to the Lancet Commission, that's the slice of the world's population that has little to zero access to even basic diagnostics. Almost half the planet. Just let that sink in.
This massive gap creates what experts are calling diagnostic deserts. And it's the perfect term, right? It describes this reality where billions of people and their doctors are basically flying blind when it comes to their own health. And this quote from the Lancet Commission just hits home how real this is every single day. This isn't just an abstract statistic. It means real people suffering for longer than they need to. It means infectious diseases spreading when they could be stopped. And it means we're just wasting precious resources treating a total unknown. But here's where it gets really interesting. The problem isn't just a lack of tests. It's actually a two-sided coin. So in those diagnostic deserts, you've got undertesting, which leads to all the problems we just mentioned. But in wealthy countries, we often have the opposite issue: overtesting. We order tons of unnecessary tests that waste billions and can even lead to procedures that are not only pointless, but actually harmful. Okay, so what happens when doctors are forced to guess? Let's talk about the consequences, because the ripple effects are, well, they're devastating. They're fueling two of the biggest threats we face in modern medicine today. Threat number one is antimicrobial resistance, or AMR. You've probably heard about this. It's the superbug crisis. It's where our life-saving drugs like antibiotics just stop working. And guess what? It's directly connected to our failure to diagnose properly. So here's how this vicious cycle works. A patient comes in sick, but the doctor isn't sure if it's a virus or bacteria. To be safe, they prescribe a broad-spectrum antibiotic, just in case. But here's the kicker. Something like 30% of these prescriptions in U.S. hospitals are totally unnecessary. And every single time that happens, it's like sending the microbes to the gym. We're training them to defeat our best weapons. And the cost? It's already staggering. Back in 2019, an estimated 1.27 million people died worldwide directly because of AMR. To put that in perspective, that's more than died from HIV/AIDS or malaria that year. This is what happens when we treat without testing. And beyond AMR, there's another devastating cost to all this guesswork. Just look at this number. From the US alone, that's the estimated toll of misdiagnosis every year. The National Academies of Medicine says that most of us, you and me, will probably experience a major diagnostic error in our lifetime. That's not a remote possibility. It's a likelihood. Okay, I know, that's a huge, scary problem. But, and this is a big but, there is a clear path forward. So let's pivot and talk about the solution, a really structured approach called the Diagnostic Excellence Framework. So what does excellence even mean in this context? Well, it's not just about getting the right answer. It's so much more holistic. It means getting the right diagnosis on time without wasting a ton of resources, and this part is so important, actually making the patient part of the entire process. And this isn't just some vague concept. The CDC has actually broken it down into these core elements, and it shows you that really it takes a village. You need the big bosses in the hospital to be all in. You need experts from different fields working together, and you absolutely have to involve patients and their families. It's about building a whole system that's smarter and safer from the ground up. Now, building a new framework is one thing, but you gotta have the right tools to make it happen. And this is where technology is sparking a legitimate revolution. The real heroes of this story are rapid diagnostic tests, or RDTs. We're talking about things like the tests for COVID, the flu, or HIV that give you an answer in minutes instead of days. They're accurate, they're portable, they're easy to use, which means you can bring the lab right to the patient, no matter where they are. And if you want to see the impact, just look at this.
One study found the median time to get a result from a big centralized lab was 35 days. 35! With a rapid test done right there at the point of care, that dropped to just 1 day. That's not just a little better, it completely transforms how care is delivered.
And the value of that speed just ripples out everywhere. Of course, you have the clinical impact. A faster diagnosis means faster, better treatments. But then there's the huge economic impact, saving money on the wrong drugs or long hospital stays. And then there's the societal impact. You reduce the spread of disease, people get back to work faster, and you build more trust in the entire healthcare system.
So we have the framework, we have the tools. Now for the final piece of the puzzle, and it's probably the biggest challenge of them all. How do we make sure these amazing solutions actually reach everyone, everywhere? Well, this is the tough reality we're up against. In a lot of low and middle income countries, the World Health Organization estimates that only 1% of primary care clinics have even basic diagnostic tools. 1%. Think about that. But here is the good news. The world is finally waking up to this crisis. In 2023, for the very first time, the World Health Assembly passed a resolution focused entirely on strengthening diagnostics. You have groups all over the world mobilizing, demanding that these promises turn into real action on the ground. And this quote just says it all, doesn't it? The whole idea of health for all is just a fantasy as long as half the world is living in a diagnostic desert. It is the single weakest link in the entire chain of healthcare.
So, I want to leave you with this question to think about. What does a future where everyone has the right to a correct diagnosis actually look like? Just imagine a world where every single medical decision for every single person starts not with a guess, but with a clear, confident answer. That's the future we're fighting for. And for the first time, it's a future that actually feels within our reach.